Another sinus arrhythmia is sinus tachycardia. By its very name, sinus tachycardia, it means that it follows the typical and normal electrical conduction pathway beginning with the SA node. The term tachycardia refers to a rate that's greater than 100 beats per minute, in particular when it comes from the SA node. Remember that the inerrant rate of the SA node is 60 to 100. So in bradycardia, remember it was less than 60. For tachycardia, it's greater than 60. Sinus tachycardia often starts and stops gradually. This can be a normal variance, such as with exercise and in children. When we exercise, we increase oxygen demand. Therefore, the SA node will increase its rate of fire to compensate. When you have somebody in sinus tachycardia, vagal maneuvers may not be effective, and vagal maneuvers are things that would stimulate the vagus nerve, causing the heart rate to slow down. That would be things such as coughing, bearing down, pretending you're blowing into a balloon, and such. Most of the time, those maneuvers would be ineffective for straight sinus tachycardia. Let's take a look at a couple of strips. In this top strip, if we were going to simply start following our 3R mechanisms and analyze this strip, we can already see that it's a little bit fast, can't we? If we were to count this strip, we would see that it is indeed, when we're looking at the hash marks between the 6 seconds, we can see that there are 14 complexes on this 6-second strip. And if we multiply that by 10, that would be a rate of about 140. So that is pretty quick. If we're looking for regularity, as we're considering the regularity of this rhythm strip, it would be helpful if we would march out the R to R parameter. So I put a line here measuring the first two complexes at the top of the R to the next R. And if we march this across, we'll see it's the same line. I'm just adding it over and over again. We can see that each complex comes at a regular interval. So that being said, this rhythm strip would be considered to be regular. So we did our first R, which was rate, and we can see that it's greater than 100, which makes it in the tachycardia by definition, the tachycardia classification. We can see that it's regular, which is our second R, standing for rhythm. Is it regular or irregular? And we can see that this is indeed regular. Then again, we want to look at our third R, which is relationships. And we want to be sure that there is a QRS for every P, and we can see that this strip does have intact relationships. All of our complexes look consistent, they look like one another, so therefore this would be considered a sinus tachycardia. Sinus because it originates from the SA node, as we can see by the P wave, sinoatrial node has stimulated this electrical activity. And then we have a QRS after each P, meeting all of the sinus criteria. We see that it's regular and it's greater than 100, so we have sinus tachycardia. In the latter strip, the lower half here, the gray and white strip, we can see that it also is fast. If I counted the complexes, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's about 130. And I can see that it's regular. I did not march this out in the same way I did the strip above, but we see that it is regular. We see that our relationships are intact. I see a P followed by a QRS. So again, this would be sinus tachycardia. Looking at some of the causes of tachycardia or sinus tachycardia, some of them can be rather benign and things that you could readily correct, such as a fever, pain, anxiety, and fear. Those you could certainly give some antipyretics or some pain medication. You could use some verbal de-escalation with your patients and so forth. It can be medication related. The patient could be hypovolemic, meaning they have lost volume either through sweating, loss of fluids, or dehydration, or perhaps loss of blood. Caffeine can stimulate the heart, causing tachycardia. Hyperthyroidism can increase metabolic rate. And then exercise, of course, I'm going up the second column. When we exercise, our heart will speed up to meet the demands of the body. Hypoxia is another situation where if you have low levels of oxygen, your heart would want to compensate and deliver the blood to vital organs more quickly so that it could get the oxygen that is available. Signs and symptoms are going to be dependent on the situation and the patient, their volume status, and so forth. You could end up having shortness of breath. You could have shock signs, signs of decreased cardiac output. And what would we do? Well, we're going to monitor the patient, obviously assess their vital signs, and then we would treat underlying causes or conditions as we identify them, meaning treating that fever, treating pain, giving back fluid volume, and so forth. If you have an acute MI and you go into sinus tachycardia, you may end up going into some acute heart failure because the heart just can't keep up with that volume. So this has been a lot of information on sinus tachycardia, and as always, if you have questions on the content, please be sure to post them in our Raise Your Hand discussion forum on Blackboard.